Now I'll be performing a clean dressing change. So I have my wound, sterile saline, gloves, my container for my sterile saline, ABD pad, gauze, tape, and that is it. And I'm going to take my gloves off because I shouldn't have had them on. But I'm going to verify my provider's orders, and I've already gathered my equipment. I would walk in, introduce myself to the patient, and explain to them that I'll be doing a dressing change today. Some of the types of dressings that you may find on a patient is like a hydrogel dressing, a foam dressing. You have dry gauze, you have transparent, you have like a medicated dressing. It may be like impregnated with some type of medication or anything. Then, so I'm going to begin my dressing change. I washed my hands already. I'm going to apply my gloves. I'm going to begin by pouring my sterile saline into my container because I will use the solution to saturate the gauze so that I can provide cleaning to the wound. So I'll pour my saline in. And I will take a gauze and soak it in the saline and clean along the outside edge of the wound, and this will be disposed in my biohazard bag. Then I would do it again with another gauze and clean the alternating edge of the wound, and I would dispose of this one as well in a biohazard bag. And then I would soak another gauze and clean the middle of the wound, and I would dispose of this. And then I would take another gauze and dry in the same pattern, patting along the edges of the wound, disposing. And then I would pat along the middle of the wound and dispose of that gauze as well. Then I would place a gauze over the wound with my ABD pad on top, and I would secure my ABD pad with tape along all of the edges. And when I was doing the wound change, you should assess for redness, any swelling, any tenderness, maybe like an odor. You should also ensure that the wound appears to be healing and not getting worse. So you may have to measure it for the doctor or have wound care measure it. I would take off my gloves after I gather my equipment and dispose of that. I would take off my gloves. Document how the patient tolerated the procedure and the appearance of the wound. If the patient complained of any pain. And that will be it for my documentation. Some of the reasons why a patient would need wound care, some of the goals is to decrease pain, to decrease the chance of infection, because you don't want any of those nasty, dirty, saturated gauze just hanging around for too long. And you really want to promote wound healing. So in order to do that, you have to ensure proper dressing changes and the proper dressings. So if a patient has to have a drain, sometimes it's because of surgery or the wound may not be healing properly. So you would have like a JP drain. You could have a wound vac. Those are pretty popular. You could have a Penrose drain. You would use it to remove substance and fluid from the body, which would help the drain heal faster. And you will want to monitor for drainage, any swelling, any redness, any pain, and any warmth. So that would be it. Thank you.